in 1998, I opened up United Elder Care Services, which is a geriatric care management company. We are a full-service geriatric care management company. We own and operate our own nurse registry, and we own and operate our own skilled Medicare home health agency. Social work services, which are the most vulnerable people in our population, the disabled, elderly, and infirmed who need social work services, those services are not covered by the Medicare beneficiary program as a standalone service. Hence, our service in 1998 began delivering those services. Boca Home Care Services is a licensed state nurse registry, and Boca Home Care Inc. is a certified licensed Medicare home health agency. And they work under a greater umbrella, which is that we also are able to deliver geriatric care management or guardianship services. Again, the goal, and I promote this as the national president for the Private Care Association. I've been the national president since 2010. The goal of the way we think is that nobody calls us when they're healthy. We deliver services to the elderly, the disabled, and the infirmed, and they're always calling a day late and a dime short. And even though they do that, they're calling us with a response. They want us to help them with their presenting problem. And so that's what we do well. I'm fortunate that as president of the National Association, I'm able to work on creating the standard of excellence that we want even my competition to adhere to and to provide, and that's what I work on as well. The best type of individual who's referred to someone's home is someone who is consistent in delivering that service. What we're able to do in our office, right, is that we're able to match individuals with the amount of money that they want to make on a case. In other words, the family knows what they want to pay, and the caregiver knows what the reimbursement is going to be on the case. Right? And the reason that works so well, right, is because there is an agreement, there's a speaking of the mind. And that's very important when the payer source, right, 80% of cases today in the United States are paid for by long-term care insurance. So if someone's going to get X number of dollars, $200 a day, they want to figure out a way, how do I maximize that money and have 24-hour care? So we are extremely proficient in matching that relationship. The caregivers that we have in our registry, in our pool, have been with us, some of them have been with us literally since the year 2000, literally for the last 11 years. And that's, I think that speaks to our success. On the skilled services, unlike many other certified home health agencies, our professionals, our occupational therapists, our physical therapists are not contracted workers. They work for us directly. The difference is that in the skilled setting, when the doctor says, I want something done a certain way, we take ownership of that delivery system. And that's how we've been able to be extremely successful. One of the challenges that we face on a national level is the cost of delivering in-home care services. And there's currently a recommendation by the Department of Labor to get rid of something known as the companion exemption, which means that right now Mrs. Jones, who leaves the hospital and goes home, is able to have in her home 24-hour live-in care, right? And she doesn't have to pay overtime. And so what I try to educate members of Congress and the Department of Labor and others is that caregivers can get overtime if they want to work in a hospital or nursing home center. But Mrs. Jones, who lives at home, doesn't have the choice. She's got to pay for her care to remain at home. And so we've made great strides in the area of education. I think at the end of the day, the best delivery service, whether it's the new president's health care bill or whether it's issues of custodial care, whatever is the issue, I find that people get more for their buck if the first step is through education. And so that's, again, what we continue to try to promote. So in the next 10 years, we have to figure out a way to create programs where private enterprise will be able to pay for care. I don't know how that's going to work, but that's kind of where it's going, I have a foundation in my father's memory, and the tagline of the foundation is "Education is freedom." Again, whether it's in business, whether it's delivering home care services, whether it's doing homework with your children, the key to success is the education that's behind it. And so the way we deliver charitable assistance to the community, or giving back to the community, is by we support local schools. We support students who can't pay for their books to go to school. We help with tuition. We donate services to the Alzheimer's community care. You know, it's not always money. Time is a charitable gift as well. And we sit on various boards. Personally, I sit on 2 university boards. If I'm a successful individual, it's because I have a partnership with a being stronger than I or higher than us. And so if I'm successful, it's bigger than me. It's not because of me. I'm just the facilitator. So we give back because we know that it's not purely about Joseph or Lisa. It's about a greater good.